one example I can give, when I left Madras and joined in Bombay in 1988, everybody did not know about vitreoretinal surgery. And so happened in one of the GPs asked me when I gave him the card vitreoretinal surgeon, he asked me, "Are you dealing with anorectal surgery?" You can imagine how I felt. So after that, I write eye specialist and vitreoretinal surgeon. So what I'm trying to tell is, I had to start from ABC about retina in '88 because even the surgeon's fee for a cataract with IOL and retina was same. Whatever you do, whether you do oil or PFCL or whatever, it was same. And they said, what is the use of paying you more? Because whatever we do, you're not going to get more vision. So that's why we will only be this much. So I had to do so much. So I started writing in newspapers about what is myopia, why cataract should be, before cataract, retina should be checked in a myopia, and what is lattice, what is. So what I'm trying to say, I think that's what I learned from now Tulsi's slide. I think that's the most his presentation. I think we have to make the whole country aware that that's why I have made a slide. My slide, it'll come. I'll just quickly run through the slides given by my team in the clinical, which I didn't want to present, but I'm just running it through. So this is the prospective. This is what we are doing with the BRAC, a prospective observational hospital-based multicentric registry for select retinal diseases. Thanks to Gopal Pillai and team, we got about 10 crores, and this is the team: Vibhuti Shiba from Trivandrum, Harsha Bhattacharya Guwahati, Alok Sen from Sadhguru, and myself and Aditya Jyot. And the primary objective is, I'm not going into the detail. This is a multi-center national hospital-based prospective cohort study to study patients with diabetic retinopathy, retinal vein occlusion, age-related macular degeneration, and stages over the years. These are the three we are covering. Dr. Gopal Villa had, I told him we have to create drcr.net, and from DR it went to 3. In the beginning, he said, no, we want everything in retina, but it's not practical. So this is what is the recruitment modality. We are also having the endpoint, and first patient in April 2021, and the last patient in December 2021. And this is what we have decided. And then we also have the flow chart of the study. The main thing I wanted to tell is the government of India has given money. We have recruited 11 staff in every center, and data will be collected in the case report form and be entered into the database, that is in the RECAP. So this is what I think we have to do for diabetes, and this is only a 6th center. As this is a registry, only data will be collected, which will be done by the investigators and designee. And there's a protocol deviation and the references. So I'm thankful to my team, to the PIRAC team who are in the group now, and the original talk which I planned. Now, this is I made a impossible dream as my project for myself. I taken it personally. I call it Diabetic Blind Free India 2025. And I know it is impossible, but I decided from the word impossible, you should make it possible. So my inspiration is Swami Vivekananda, and this is from the website of the Ramakrishna Mission Tribal Center in Sakwar. Sakwar is 130 kilometers, which I'll show you. First, feel from the heart. Are you seized with that one idea of the misery of ruin? And have you forgotten all about your name, your fame, found any way out and any practical solution? And this is what I was wondering, like Swami Vivekananda, after my grandmother died. And I think in your quarter, there are lots of poor people sunk in degradation and misery. And that's why I went to Kanyakumari, Kutralam, the Vivekananda Ashram, the Ramakrishna Mutt. And you will have to go to them and serve them with your zeal and enthusiasm. Arrange to distribute medicines to those who are sick and nurse them with all care, supply food to him. I'm glad I'm doing both. This is Roti Bank, what I have is part of, we are a trustee, myself and Shivanandan. We are daily giving 10,000 meals to free. They're not out of this context, but I want to just say what Vivekananda mentioned. We are trying to do that. Not we are trying, we are doing. Teach with us as much as lies in you, the ignorant. And if you begin to serve your brethren in this wise, I tell you, my child, you'll surely get peace and consolation. I think that's a lesson from Dr. V, which is the last 2 slides from Dr. Nam and Dr. Mr. Tulsi Raju saw, and that's my inspiration. And Sakwar is situated on the Mumbai-Ahmedabad highway, and I've decided to go and work there. And we have already started a free camp on the Swami Vivekananda's 158th birthday, which was January 12th, but we did on January 10th, a Sunday. This has 500 villages of Vasai, Palghar, Danu. We are already working with Palghar, with government of Maharashtra. Vikramgarh, Wada, Jawahar, Mokoda, Bhiwandi, Sahapur taluks of Thane district. And this is what I want to say. And what the Swami Arvind is doing in the various villages of Tamil Nadu, Shankaranachala is doing, Elvi Prasad is doing. And this is what I am trying to do in Maharashtra. At that time, people lacked easy access to medical services, education, and even trade to earn any income. The monks and volunteers, including doctors, conducted a medical camp every Sunday near the village Sakwar, and that's what I also joined as a volunteer. And this is, I'm glad on January 12th, Swamiji is here. I had the opportunity to go up the snorkel and call in Swami Vivekananda, which is which is in the gateway of India, on welcoming Swami, or rather, when Vivekananda left Mumbai from Mumbai port to go to Chicago in 1895. 3 days he went in Chicago. And so my talk is combating the epidemic of diabetic blindness in India, diabetic blindness free in India 2025, and no financial interest. And it's my dream and a vision to eliminate diabetes-related blindness from India by 2025 and eventually the world. And this is a Herculean task. One man cannot do it. And screening is the most important step in the prevention of diabetic blindness. I would like to outline the components of my dream. I very well understand Shobha and Kim's point. It's not ophthalmologist's duty, but I think I'm doing just as a human being. I think this is my dream, and I decided to approach every door. That means a Association of Physicians of India, government, municipal corporation, CSR, the corporates. So I wanted to, I'm working on remedy, no financial interest, use of smartphone to take good retina photographs, portable, sustainable, cost-effective equipment for screening at large population, training unskilled worker. That means take up any boy, peon, and make them semi-skilled and generating employment among the uneducated youth of India, preventing them from being burdens to society. I found there are 6,669 villages in India and generating semi-skilled manpower to screen diabetics. And Rajiv correctly asked who will fund the equipment and who will maintain and who will pay the salary to these people. And that's a big question right now, but I am looking for the answer and I'll get it. So early prevention of diabetic blindness, screening and early detection of referable diabetic retinopathy, either use regular AI or offline AI, which can prevent. And as AIOS president, we have signed a MOU with the Government of India to train unskilled personnel into semi-skilled personnel for being a part of screening team, giving honor, pride, and a gainful employment to the youth of India. We have 3 boys who are 9th pass, and then there are 2 women who are 8th pass, but they know everything about eye, and they can screen them, and then they also enter in the computer. I think they just know the task and they do it. Sustainable border, that's what is important, and scalable, which does not require electricity or internet connectivity to work, and best for rural area, and equipment can be easily transported on motorbike and 2-wheelers. And we have already done from 2014, it's 8 years. So this is the first training camp in 2010. Thanks to Dr. Hitesh Sharma, came as a volunteer. So I'm going to invite, there are 2,000 ophthalmologists in Mumbai. Apart from my foundation, we are going to have various doctors as coming. So all of us know World Diabetes Day on 14th November. This also, I gave the talk in the AIOS president, screening through teleophthalmology to prevent diabetic blindness called Stop Blindness. Jot Jala was their Indian name. And we all know that it's an epidemic happening, and it is the 5th cause of blindness globally. And this is Dr. Babu Rajendran, who made it for IMA, and during Dr. NSD Raju and Dr. Quresh Maskati. Diabetes invariably affects both eyes. Test your eyes soon. And we all know the statistics, and this is a mammoth number. The numbers are keep on increasing. We found the 77 million as may now be 80 million, as Dr. Nam said. So finally, I remember my preventive and social medicine professor. We recommend primary checkup at the time of diagnosis every person, and that's why all of us, like Kim, Dr. And Tulsi, and everybody saying the primary physician to take care. The prevention is better than cure. So I want to show this movie, which is done by International Advertising Association. The president of All India Ophthalmic Society. I would like to thank the International Advertising Agency for starting this competition for making a campaign on preventing diabetic blindness. And I also like to thank Allergan for the generous support to make this public initiative movie to create awareness on diabetic retinopathy and how to prevent diabetic blindness. So I wish this can be put in every clinic. The AIOS Jot Jala. And are you diabetic, hypertensive? Do you know you may go blind?
will forgive you. But will you forgive yourself? Diabetic.
So this is what I want to convey, that diabetic blindness is preventable. And to get this, we paid AOS and Allergan paid 25 lakhs to get this movie. So to make it work. And I think that's the importance of working with
If you're
advertising.
diabetic, you need a retina checkup to prevent vision loss.
I think this is the message we want to convey to the public. This was screened and public service initiative to almost 4,000 times and all over all TVs. And now trying to work with Government of India. I spoke to Pramila Gupta, and she told me to remove the names and send it to her. We have done that. And so the plan of action is screen, diagnose, and treat. And this is what I think we want to enforce. It's not that screen and then leave them high and dry. No, you screen, diagnose, and treat. And that's what is the philosophy we want to do. And this is a pre-campus awareness, which and we all know the various diabetes parts. We need dietitian, endocrinologist, and ophthalmologist to work together. So I think the main thing is we have one ophthalmologist per 100,000 population, low awareness or ignorance, and 70% of Indian population resides in rural area or urban slums. And technical difficulties, unreliable internet, deficit in supply of electricity, shortage of trained medical staff for operating conventional retina cameras, portability of conventional fundus camera. And this is my favorite statement to all staff. Intelligence is the capacity to analyze, think, make a decision, and categorize, which is commonly lacking. And that's why we are going into artificial intelligence. Thanks to Rajiv and Kim, they are working, pioneers in AI in diabetic retinopathy. So AI involves formulating a specially made algorithm according to our needs to develop this capacity and include it in an electronic device like smartphones. And this is one which I am showing, but we can use any camera. And this is which can be mounted on a suitable bike and can be mounted on any table, chargeable. So I made this called Anybody Can Screen Diabetic Retinopathy. That I made this from the movie Anybody Can Dance, ABCD. So ABCD is Anybody Can Screen Diabetic Retinopathy. And this is again, no financial interest. This is a mobile camera where we have trained boys who cannot read English, who cannot read or write, but they can speak Marathi in Maharashtra, and that's my dream. I've convinced Shaft Charity to train like that in Delhi. So we approved it to the health sector skill development under the skill development, and that's the AI part which you are seeing. I'm not going into the technical details. The idea is to say we can have images, and then as Shobha rightly pointed out, I think we have to work on the legality of a patient consent form, but we are taking consent form, and it says the photograph taken is confidence is 99%. So I think Forest also has got that, and we can go in, and I'm not again clinical staging, comparison, AI. I'm not going into the detail. So this is the research question we had. Is AI reliable to pick out those in need for seeing an ophthalmologist? And that's what, thanks to Shobha, my crew, Radhika and Ashwini, for this publication, Diagnostic Accuracy of Community-Based Diabetic Retinopathy Screening with an offline AI system on a smartphone. Thanks to Alvin Liu for a wonderful review he wrote, as well as in American Academy in 2019, they said the future is here already using the mobile phone. And this was the first of its kind, where use of offline AI for screening diabetic retinopathy, using semi-skilled workers in a municipal corporation of Greater Mumbai, sponsored by the Aditya Jyoti Foundation. This was a pilot study. Again, this was the JAMA ophthalmology, and the reliability to rule out non-diabetic is about 81.9, but referable 100% reliability. So reliability of AI for screening population for diabetic retinopathy in need of ophthalmic checkup by an eye doctor is 100%. And this was the advantage of using AI. Early referral of referable diabetic retinopathy, greater awareness about diabetes, its effects and importance of regular follow-up. So one of the ideas which I have is to have a self-examination, which I don't know how it's possible, like a kiosk in the railway station and the airport, one day may be possible, so that the referred patients can come to the eye doctor and have more chat time, timely medical, surgical intervention to prevent complete loss of vision, more job opportunities, more working hands, skill development of less educated. So the points to remember: trained and I employed youth of India, even with minimal education and no experience in previous experience with fundus photography, to reach out to save millions, vision of millions, independent of electricity and internet, better chat time for referred patients, timely treatment in preventing blindness. So I request that we start a monumental revolution, fight against diabetic blindness, and I want each and everybody, and I request Kim, and this is our foundation. Thanks to Dr. Kalam, who gave us the name AIOS Foundation for Twinkling Little Light. Thanks to my team. This is Mr. Shivanandan, who's a great support. And that's a van for diabetic retinopathy screening. And this is a motorbike where you can see my grandmother at the, I think 2014. She was 95 or so. And she inaugurated along with my late father, Dr. N. Sundaram, there is Shivanandan and Dr. Radhika. So my inspiration again, arise, awake, and stop not till the goal is reached. So I think Dr. Venkatasamy at the age of 58, after retirement, started Arvind, and now I'm at 63, and I decided to take this monumental revolution, the lead only, like Gandhiji as a self satyagraha. And I hope I will have everybody to do, and I want to lead from behind, so that we want the youngsters, which is Swami Vivekananda always depended for tomorrow's India, to do this program. And that's why we'll involve Young Ophthalmic Society of India, All India Ophthalmic Society, and all the medical organizations. So I'm again glad that myself, Dr. Badinath, Dr. Venkatasamy, and many from here are 200 part of this government eye hospital, where the 200 glory years of modern ophthalmology. That's my late grandfather, Dr. Natarajan Pillai from Madurai, and my father and myself. Thank you very much. So thank you, Dr. Kim and Tulsi, and I think probably Dr. Nam has left, I think, but Dr. So Kim, your comments.
Thank you, Natarajan. I think this is a really much needed initiative. I think I'm glad that you're bringing it to the forefront, and hope we can move forward, make a big impact in the next year or so. So
thank you. And Shobha and Dolores are here. Yes, Kim. Yeah, thank you, Kim. And Tulsi.
I think my concluding remark is the ball is squarely in our court. No, so I think we'll have to get our act together and figure out how to go about doing this. This will be a much more challenging task than cataract or glasses. No, even though there are some commonalities, this will require a very different approach. I think we also have to be innovative. And I think we also will have to depend quite a bit on technology. So I think we need to drive that. I mean, today, Google is driving technology, but I think we need to start driving some of that, so that it really gets developed, optimized to our needs.
That's why, as AIOS, I took the lead. And I think when I met Kim, he was saying, why are you struggling with all that? He gave example of government of, he got the funding and gave it to Tirunelveli PSC and Medical College, the OCT funded, and finally they didn't use it. I know it's frustrating, and everyone noticed, but I think, as you said, I have taken it as our court in ophthalmology, and that's why I'm moving this from 2018, I think, I'm pushing. And even Namrata was asking, I think Rajesh is here. Rajesh can speak there. Rajesh? In the meantime, Shobha, I agree with Tulsi. I think it's in our court.
Yeah.
And even though Kim and Shobha are working and suggesting that a physician should start, and instead of waiting for them to start, I have already started the ball. And I think make sure that we all as you rightly said, we have to be I always tell this, technology should be under our command, and we should not be a slave to the technology. And as you said, Google is taking the lead. I think we can take the lead. And that's why I'm trying to work with the AIOS and I think we have to have a national leadership, so that it is not belonging to one institute. So that there's another thing I found, and slowly I'm now trying to remove the word AIOS from my foundation, which is a big legal process. The idea was to say the foundation for twinkling little lights, so that I don't know there's no need for Natarajan name or AIOS. That's what I'm trying to say. Same thing with this committee. The AIOS is the name to be given, and I've written that Hindi Jyot se Jyot allow.
Dr. Natarajan, I wanted to say, I mean, thank you very much, but I want to say that what I meant, I think Dr. Kim also meant the same, is that we are the drivers, but the screening should be done by the diabetologist and the PHC and all that. For that, we need to drive them to do it. So we are still the drivers. Dr. Tulsi Raj said the correct thing. We are the drivers. You are the driver as well. But I'm saying that primary screening, we shouldn't waste time on it. We should teach or encourage all the others to do the screening. And then we take the bulk of the treatment.
Exactly. Yes, correct. No, that's what I give talks in all the ophthalmic meetings where I tell we are going to use AI, we are going to use technology without eye doctors and without doctors. So that screening will have to be done, driven by us. And I think I'm happy we are finally coming to a conclusion of that whole thing, that will be done by non-medical people, trained people, so that they report and send the images to the ophthalmologist, and we decide whether using AI, offline, online, or even physically, what Sendil is doing. I agree. I think finally all of us are on the same page. Thanks to Tulsi for telling, take this onus and take the ownership. And this is what which usually lacks in any project. So I have decided, and I'm happy our team here is always with us, and I'm glad all of us are working together. And Rajesh, do you want to say something, Rajesh? Are you there?
No, absolutely fine. Actually, it's really good that, I mean, we have such good seniors who are there to guide us and help us to, do some good things for the society. I mean, and AIOS should definitely, take proactive, action so that we can do some. So I'm really glad
yes,
that,
Shobha wants to leave. Thank you, Shobha, for taking part. And Dolores, do you want to say something?
Yeah, it's been very interesting for me. I mean, working on Ornate India, we're learning a lot about the issues we have with screening. But one of the main issues, obviously, is patient awareness. And, it's been touched on today, with cataract, you lose your vision. With diabetic retinopathy, you can be asymptomatic. So I guess I was thinking, if we're going to screen through a physician-based method, that's going to be much easier, because the physician will be able to explain to the patient in much more detail the reason that they're having problems with their eyes. Whereas sometimes when you go through a screening program, you don't get that explanation from the person who's screening, because, if you're using people who are screening that are semi-skilled and all that, they won't have the knowledge to inform the patient why they need to be screened, why they need to get treatment, why they need to be screened annually. So I think there's a lot of work to be done around, obviously, the patient awareness as well.
Yes. So Rajesh, there's a lot of things can be done in the name of awareness. Actually, we can increase footfall for every ophthalmologist in the country. What I'm saying, Rajesh, we can approach Doordarshan. That means it's a national telecast, which you can take the lead. You don't, as Namrata said, I'm not a retina specialist. We don't need retina specialists. We want people like you, whatever you are, cornea, comprehensive ophthalmology, anybody. I'm telling your ophthalmologist from AIMS, and you're a professor. I am suggesting you can take the lead, which will help yourself for many things, which I'm not telling now. But I think what I'm telling is, you can take this help me to advocacy in the governing council and make it as a program. And I've told Dr. What's his name? Dr. Suvidi is here. Don't ask for funds from AIOS, and I am also not going to recommend that. We will not ask you funds at all. But I want you to lead this for advocacy. For example, every time I can't come to Delhi, you can lead the AIOS DRs committee. I'm not the chairman. You're not the chairman, but you're a treasurer of the bearer. If the president wants to go, or a secretary wants to go, or XYZ joint secretary, joint treasurer, or what I'm saying, you take them and represent what we want, so that you can sit with the secretary, who secretary health, and that will be a national policy. And then every state, our own AIOS member, who the state member, should do it. So I think in the name of awareness, we can create. Ophthalmology is a very important branch. Please check your eyes. So I think if you do that, everybody will appreciate you, Rajesh, because everybody will get revenue. So I gave this talk, how to increase the revenue by screening for diabetic retinopathy. So Rajiv has come back. Rajiv?
Yes, sir.
Yeah, come back. Can you?
No, I'm here only.
Oh, you're there. Okay. Then you are join. So Rajiv, and I'll request Rajalakshmi to help me. I know I'll have the recording. I will send it to you, and we also will get the presentation. I think Dr. Nam, I already have. So Rajiv, your points and Rajalakshmi.
No, sir, all points are very valid. I think we need to now go to the next step. So what we have thought of, we'll go through this and probably create, as you rightly said, multiple tasks for each one of our group members.
Yeah.
Okay. So can you help me in doing that? And then we can send the mails and then call them, talk to them.
Sure.
And maybe in a month's time, we meet again in the Zoom.
Yes.
Okay.
Sure.
Rajalakshmi? 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 Maybe she's gone somewhere. Parikshit, I know you joined late, but Parikshit is helping, and he's already got publications on these things along with Dr. Salil Gadkari. Parikshit? We both are okay. So I think I thank everybody, and I know I crossed 20 minutes because I think we over enthusiastically discussed Dr. Nam's, because it was a brilliant presentation, not only history and his involvement personally. And I think really it's and I'm happy that that he gave that thing, and I'm happy we have the presentation. And thanks to Tulsi for a real tangential way of thinking, which is important, out of the box thinking in the management, which is important. I think I'm going to, I won't say trouble, Tulsi, but we are going to be constantly seeking from you. We want your guidance, and we will keep. And I think by the way of publishing, I think I'll ask Rajiv and Kim to work with you. And now we have one part of the team can work with you to publish, so that we can make it as a publishing, so that it's like a promising what all we'll implement. And then also take notes whether whatever we planned, are we going the right track, or we have to change the way of working so to get a better result.
We're happy to help. Yeah.
Thank you. So I'm happy Rajesh Sinha as a professor of ophthalmology and cornea surgeon, and also FBS is with us. And I'm very happy because I know personally I've impressed Rajesh that so much I put my heart and soul in this project from 2018. And even Navarta was asking, how come he started working as the president, even though I'm not a president. So I'm happy we have done that. 91 talks as a president of AIOS.
That's why I told that you have been working for last few years on this thing.
Yes,
so we should definitely move forward and take it to the next level.
Yeah, so I have actually requested everybody has agreed except Dr. Nayak that this committee should go on for years. So I suggested I'm going to hand the baton when after maybe 2-3 years after everything settles, without problems, to Rajiv, and then later to Kim also, so that they have to keep running. And by the time we should select somebody who's 30 right now, so at the age of 40 they can take over. And that's the plan for me, because diabetes is not going to be over. Whether it's 10 years, 20 years, 50 years, I think diabetes is going to be there. And I remember Peter Hamilton coming and telling in 88, hey, we will finish all vitreoretinal surgeons out of work by doing laser. Did it happen? It happened. I think PRP was done. Now anti-vascular practice is being given in US. And Kim knows, and I know that even today in a New York clinic or in a Baltimore, they have with PDR, they come with neovascular glaucoma. I'm not criticizing, but it happens because patients, 100% of the patients don't know about diabetes. So I think all ophthalmologists will have work. So that's why we don't have to fight for only cataract, Rajesh.
Yeah.
No? If you screen for diabetic, you will screen diabetic for, you'll have glaucoma, you'll have cataract also diagnosed when the media is hazy. So good. So I take this, Rajalakshmi, final, you want to say something finally, so that, and Parikshit, no, they are not able to hear, probably they have gone to work. So thank you, Kim and Rajiv, and you are the real, the anchor man for this committee. So I'm backing like whatever we have started, and all of us I'll be there even after retiring to support all of you, like Dr. Nam is doing, which is amazing. I'm really happy that my visit and meeting him really has gone to this. From meeting, now we'll start implementing. So that I do it as a promise. We'll meet in 1 month's time. Thank you, Kim. Thank you, Tulsi.
Thank you.
Thank
Bye.
you, Rajesh.
Thank you.
Thank you,
Thank
Subudhi.
you. Bye.
Thank you, Dollar.
Thank you,
Thank
sir.
you, Dr.
Okay.
Natarajan.
Thank you.
Paresh,
Bye.
appreciate this. Yeah.
Bye.